The meeting of the Public Education Subcommittee is coming to order. And I believe we have a quorum, but let's take roll call. Senator Howell. And if our subcommittee members will please turn on their mics in order to either take a vote or to call in present, that would be helpful for staff. Senator Howell?
Here.
Senator Locke?
Here.
Senator Donovan?
I am here.
Senator Peake? You have to press your mic on there.
Just mic on. I'm here.
Thank you so much, Senator.
Senator Hashmi?
Senator Hashmi is here. Thank you. And I think we'll go in order because I don't see Senator Mason yet. Is Senator Mason still in the room? Let's go in the order that we have here. First bill is SB 1099. Senator Stewart. Let's come back. I believe Senator Mason and Senator Stewart are in conference over the bill. Let's go to SB 1114. Senator Peake.
Thank you, Madam Chair. And this is my 1114 CSA, which also goes with Senator Mason and Senator Stewart, which we're talking about in a similar CSA bill. And Senator Mason and I were discussing this as part of his JLARC study earlier. Currently, CSA funds are restricted to pay for private day school services only, and this prevents children from receiving comparable services in a less restrictive setting and at public school setting. So the purpose of this bill is to allow public schools to set up the type of facilities, education classes to teach the kids that would be getting paid for private school through the CSA. And then as I was talking with Senator Mason earlier, I think you're correct. We are asking for CSA to pay it, but it would go to the local school divisions. It would save our local school divisions a lot of money. And I believe there are people lined up to speak in favor of this.
Thank you, Senator Peake. Are any of the committee members, would any of the committee members like to speak to the bill first? Hearing none, let's hear from our public, individuals who are supportive of the bill. If you will raise your hand. And I believe I see Miss Janet Oakes, if you will speak. And we have a limit of 3 minutes in entirety for all who wish to speak in favor of the bill. So please limit your comments so that others who wish to speak in favor of the bill can also use their 3-minute allotment. Thank you. Ms. Oakes? Is Janet Oakes on the line?
Madam Chairman.
Yes, Senator.
I know that Janet Ox is in line to speak on my bill, so I don't know if it's possible that she's also speaking to this bill, but I think she's one of the constituents I have on mine to speak to a later bill.
Ms. Ox, are you here to speak to SB 1114 or another bill? Since we're not able to hear from Ms. Hawks right now, let's hear from Mr. Smith. Tom Smith? Mr. Smith, I see you in the room. Would you like to speak to the committee? We will come back to Mr. Smith. I see Mike Aesop. Mike, would you like to speak to the committee? I'm not sure if any of our individuals are able to hear us.
Madam Chair. Bonnie.
Yes, Senator Mason.
Madam Chair, I think I kind of upset the apple cart by being outside and having Senator Peake go first. And since there are a few people that want to speak and we're having technical difficulties, would you be amenable to taking his bill by temporarily and maybe returning to mine so we can see if he's comfortable with the approach we're trying to take?
Senator Peake, can we take your bill by temporarily?
Okay.
Thank you. So to the staff, we will take Senator Peake's bill by temporarily. And then Senator Mason, are you ready to present your bill?
Yes, ma'am, Madam Chairman. And once again, my apologies for being tardy. My bill is Senate Bill 1313. And so what it does is it takes into consideration the JLARC report and speaks to recommendation 1, 2, 3, 5, and 7. And if you're following along on the line items of the bill, on line items 16 and 17, you will see recommendation number 7 addressed. And that is only paying money to licensed facilities. So if there are localities that only have an option to an unlicensed, they should make sure they speak up, because this was something in the report that kind of caught us off guard, and we think we ought to eliminate that practice. If you look to lines 47 through 56, this addresses recommendation number 3 and is probably the biggest as far as the utilization of CSA funding. This is addressing using CSA money for transition services. I do have an amendment to this line item that I can take up at the end of this, if you're all right, take up at the end of the recommendation. Or would you like me to speak to it now?
If you could speak to the amendment now, and then we can vote on the amendment. Thank you.
If staff has a line item amendment on line 53?
Madam Chair, the amendment's on line 53. After the word analysis, insert or other services necessary for such transition over the 12-month period as identified in the child's individualized education program.
And I move that we accept the amendment, Madam Chair.
Any second? Second by Senator Peake. All in favor?
Aye.
Aye.
Thank you, Madam Chair. That is an amendment that came from meeting with the ARC of Virginia, that they felt like the transition services called out were a bit limiting, and they wanted to make sure we expanded. The goal here, ma'am, is that the JLARC report speaks to 10% of the students in private day did not meet the full criteria. It didn't say that they could necessarily be serviced in the public schools, but they did not meet the full criteria based on a couple of cans analysis. So our goal here in using CSA funding for transitioning is to get the largest percentage of that 10% or others who are ready from private day to transition back to the public school system. And that is recommendation number 3. Some of the things called out here, my Newport News school system says those are things they already provide. So some school systems may not, and so we just included them if they were unable to do so. And finally, Madam Chair, if you go to line 128 to 139, this is probably where we want to do the most work to try to see if we can incorporate Senator Peake, Senator Stewart, and Senator Suderline's efforts here. But we have not reached agreement. What we wanted, this is a big recommendation. This is taking CSA, the funding for private day, out of CSA and moving it to the Department of Education. So that's a pretty big undertaking. CSA funding is some sufficient. So we want to make sure that we're ready, that we're established. And so we want a work group to review that effort throughout the course of the year to make sure that if you see on line 134, that we are serving the students with the most severe disabilities, and if at all possible, serving other students in the school system. 2I speaks to that it must be equally accessible to all school systems. I think that's the intent and concern of Senator Stewart on some of our more rural areas. So this was taking in, and it also, on line 137 to 138, takes in recommendation 1 and 2, which is simply standardized reporting from the private day, which should not be a problem. Standardized format, standardized report. So as in front of you today, you see just recommendation 1 and 2 in this final clause. Our goal is over the next week to work with the private days and to see if we can find language to add things that would. Stafford County seems to be doing this in the public school systems. They would like CSA money to augment the effort. I would like to include to the work group a review of what Stafford's doing, how they're doing it, how much it costs. 2, Roanoke, Senator Sudeline, would like to bring a significant amount of these services in-house. I would like to review what that looks like, how much money it costs, and are they still going to have people out in private day, or is it all encompassing if we were to do it that way? And finally, the rural areas, in the Northern Neck was our example that individual counties would no way be able to do it. But I understand that there's a group up in Winchester where a group of counties have gone together and have set up an alternative learning scenario that does not use CSA funding. So I would like to include a rural area in the review to see how we could possibly set that up, focusing on proximity to the student being allowed to stay as close to home and receive the services they need. So, Madam Chairman, I apologize for the long-winded explanation, but we're still trying in line 128 to line 40 to see if we can incorporate some of these other efforts into this bill. Thank you, Madam Chairman.
Thank you, Senator. Are there any questions from committee members? Senator Peake.
A question, Madam Chair, to the senator from Williamsburg.
Please go ahead.
And then how would my bill fit in with what you have just described with your bill, Senator Mason?
Madam Chair, Senator Peake, one thing it would not do is immediately move money from CSA to local schools, as your bill requests. What this would do, as I understand your effort, is you kind of have the rural model where you've got a couple of counties who feel like they're paying a bunch of money to use private day and the proximity is an issue. And so they would fit into that rural evaluation to see if they combine together what an effort would look like. So to be clear, you're right, it would not give you money July 1 of 21 to June 30, 22, but it would give us an evaluation period so we can look towards the next biennium budget to see if A, we move CSA funding for private day to DOE, and if we did, what levels of these independent evaluations could we or should we include?
All right, thank you.
Are there any other questions from committee members? Senator, I have a question with regard to moving the CSA funding from the Office of Children's Services and into the Department of Education. Has that been addressed with both agencies, and what response have you had?
Thank you, Madam Chairman. That was a recommendation of JLARC, and I know at least from the CSA side they're interested in pursuing what that looks like. What's happening, Madam Chair, is the student gets an IEP at the local level, and then they determine private day, and it's kind of a siloed educational approach. Recommendation 6 is one we ought to look at to kind of break out of that silo, but since it is in the Department of Education silo, should it live there? Because at this point, CSA is almost acting just as a funding mechanism and not evaluating that decision, the IEP. It is all educationally oriented. And Madam Chair, that reminds me that this report was anything but damning to the services being provided by the private days. In fact, it said that they do not have large profit margins, but the extraordinary growth in CSA funding over the last few years, largely in this arena, serving students with disabilities, is a result of students going into programs earlier and staying in programs longer. And so that's what this report provides. And so, yes, ma'am, I do believe both agencies understand their position and are interested in evaluating it. Thank you very much.
Thank you, Senator. So we're ready to take public testimony at this point, and just as a reminder, we are going to hear from those who support the bill and those who would oppose the bill. There's 3 minutes total allocated for both the support and opposition. So at this point, we will hear from those who wish to speak in support of the bill. It's SB 1313. If you will just raise your hand, I'll call on you in the order that I see. And the first individual I see is Colleen Clementson, and I will call on Colleen, and you're speaking in support of 1313. You'll need to unmute.
Thank you, Madam Chair. Is 1313 the same as 1303? Because I'm speaking on the Emergency Opening Act.
Then that is not, we have not yet reached that bill.
Okay.
Thank you.
Oh, yeah, sorry.
No problem. Ms. Elise Davis, are you speaking in support of 1313? So then I will go to, I saw Tom Smith's hand up earlier. Mr. Smith, are you speaking in support of 1313? Please go ahead.
Yes, ma'am. Can you hear me?
Yes, we can hear you.
Margaret John Meadows, have you have no idea
All
what's
right.
going on.
She's telling
We do
me.
appreciate this.
No idea.
We appreciate all four senators bringing this issue before the committee. Bass has long proposed, and we're pleased to see the JLARC report, that we able to use CSA funds to bring children back from private placements. Our only issue would be that we would like to see it for, we'd like to see it for prevention as well as transitioning back from private placements. And the time frame of a year may be kind of constricting for some school divisions in order to complete the process. So we would like that to happen a little bit longer and prevention added as well as to support the bill as it's listed now. Thank you.
She's telling me.
Thank you. The next hand I see is Sue Rowland. Ms. Rowland, if you're speaking in favor of 1313, please go ahead.
Yes. Can you hear me?
Yes, we can hear you.
Very much. Thank you. We're all learning how this technology works. And at the beginning, I think some of us got left out and didn't even realize that you guys were moving forward. So with that, we apologize. Let me say, I am speaking for the Board of Supervisors in Roanoke County, who had asked Senator Suderline with 1133 to go forward, particularly with the enactment clause that's at the end of that bill. We have also been talking with Senator Mason. We do support the proposal that he's putting forward as a step to move in the direction that the county is interested in, as he has appropriately described during his remarks. We would also ask you all to look at the length of time just to make sure that for any of the individual children, how would 12 months or what have you be sufficient, just to make sure that we allow for the success, and that the CSA funds, that you all are clear that it may be used for these transition services, whether they're provided by a private special ed service provider or a public system. I know that's the objective here, but to be clear, that it could cover public system employees and contractors in meeting this goal. We certainly would like to move forward with examining some of the other recommendations. We do also support licensing for private providers. We want to then also be clear that we're covering the public school services in the language. Thank you very much.
Thank you, Ms. Rowland. Next, I see Mr. Elwood. Bill Elwood, if you're speaking in favor of the bill, please go ahead.
Thank you, Madam Chair. Everybody can hear me okay?
Yes, we can hear you.
All right, Madam Chair, members of the subcommittee, this has been a very long and difficult issue, and it's been much in need of a thorough and objective review, and we finally achieved that with the JLARC report issued in November. Senator Mason's bill was written from that perspective of having the benefit of those findings. The other bills before you are concepts that you've heard previously. I feel that Senator Mason has done a very good job of explaining what the specific components of the bill are. It's a measured approach. We're taking some of the JLARC recommendations and starting putting them into practice. One thing I did want to point out in terms of the 12-month issue, the intention of that is that for 12 months, CSA would be available, CSA funding would be available to pay for the services. It doesn't mean that the services would have to stop after 12 months. It's just that CSA funding at that point, the thought is after 12 months, it's really not transition services anymore. It's turned into something else. But we feel that allowing public schools access to these funds for this limited purpose would bring more students back from private placements and sooner, and we support that. We support 1313 and feel it's the best way to move forward in implementing the recommendations of the JLARC CSA report. Regarding the other bills that you have before you, we appreciate their well-intentioned concepts.
Thank you, Mr. Elwood. We're going to be quickly out of time.
We're open to working with all the other stakeholders.
Thank you, Mr. Elwood. And I see Miss Elise Davis's hand up. Are you speaking in support of 1313? Okay. Is there anyone opposed to SB 1313 that would like to speak? Please raise your hand. And if you've already spoken, if you could lower your hand, that would be most helpful. Thank you.
Madam Chair.
And I don't know who's speaking.
It's Mike Asip. I'm coming by phone. My video is down.
Thank you. Thank you, Mike. Please go ahead.
Yes, I appreciate it, and I appreciate Senate Bill 1313 and the senator's proposals. I would caution. I did send the senator some recommendations for language that, as we special ed, the word transition is a major conceptual idea that deals with post-secondary planning. So I just suggest intervening services just to avoid future confusion over these things. And also that I support many of the JLARC recommendations. VCASE, with whom I'm a active member, represents all the special ed administrators, and we support the flexibility that several of these bills provide in freeing up CSA monies to help students not just going back to public school, but also to mitigate placements. So the services, in addition to 1313, looking forward to services provided for students prior to prevent their need for special education, that being explicitly in any final bill that comes through this process.
Thank you very much. And I believe we'd have no more speakers in support of the bill. Let's hear from any who might be opposed. Ms. Smith, Tracy Smith, are you speaking in opposition to 1313?
No, ma'am. I just raised my hand to let the committee know. I'm from JLARC. I'm the associate director who oversaw our CSA study, and I just wanted the committee and the patrons to know that JLARC is here for if there are any questions about the work that we did.
Well, thank you very much for being here. We'll certainly rely on you for information should anyone raise any questions. Is there anyone speaking in opposition to SB 1313? Seeing none, is there any further discussion? Is there a motion on the floor?
Madam Chairman, I'm sorry, I didn't get my button soon enough.
Please go ahead, Senator.
I had a question. Senator Mason's bill is based on the JLARC study, which I think virtually everybody applauds that study. Senator Suderline and Senator Peake's bills were from previous years before the study. And I'm curious as to whether they would be willing to have their bills rolled into Senator Mason's.
Senator Peake.
Yes, Madam Chair, and I've discussed that with Senator Mason and Senator Howe. I'm going to ask that my bill stand alone currently, and then I'm going to discuss it with some of the counties that I've brought it and get their opinion on that, and I would like to bring that up at full committee if possible.
Thank you.
Thank you. We also have Senator Suderline. Senator, would you like to speak to that question?
Thank you, Madam Chair. Well, I would dispute two things that were said. One of the speakers who's opposed everything regarding CSA reform the last several years, in previous years always said that nothing should be done until a JLARC report came out. The JLARC report is here, and the contents of my bill are all recommendations from there. The Senator Mason's bill, which also includes recommendations, does not include as many recommendations. So I don't care as much about whose name is on the bill as much as I care about the components of it, and I would like to see the components of my bill in whatever vehicle goes forward. And I don't know, I didn't hear anyone from the ARC speak, which was a little surprising to me. So I think you'll hear from them, or I was hoping we'd hear from them and their views on why certain components of the recommendations were important. So that would be my larger view in it.
Thank you, Senator. Senator Mason, did you want to respond?
Madam Chair, and in answering Madam Finance Chair's question, we are trying to get to a place that we can look to Senator Peake and Senator Stewart's individual review issues, but will not, with my bill, get to a place where we move money to them in this fiscal year. The ARC, you didn't hear speak, even though there are a number of people that are telling me they're in the room and unable to do so, so maybe they're one. But the ARC's, the amendment that I made was directly from the ARC, the discussions with the ARC. So it is my hope that that assuages some of their concerns. And finally, as far as Senator Suderline goes, we are also going to try to get to the evaluation of Roanoke, but he has a couple of budget amendments, and I think particularly recommendations 8 and 9 that are not and will not be included in this bill. So the answer, Madam Chair, is that we're trying to make an effort in the work group to evaluate their particular circumstances. But it will not provide money for them in this year, and it will not address the entirety of Senator Suderline's recommendations from the JLARC report.
Thank you, Senator. Senator Howell, did you have any further comments?
I just am trying to process how to make this all happen. Would the suggestion then be that we recommend reporting all three bills, and then in full committee they be whatever amendments are necessary, or should we hold it for a week here?
If you were making a motion or asking
that
a question.
was a question.
Okay.
I'm sorry, that was a question.
Okay, thank you, Senator. Senator Mason.
Madam Chair, Madam Chair, Finance Chair, I think by the full committee, we will have a determination whether we can agree to do the limited things in my bill that we are going to try to do with Senator Stewart, Senator Suderline, and Senator Peake. It may be at that point that they say, hey, this doesn't go far enough, and so they would want their bills reviewed independently. I do think at least two of the circumstances, we have a really good chance to roll theirs into mine. And I would commit that by the full committee, we will have that answer, yes or no. So if we are amenable to moving them on to full, I'll commit to having that piece taken care of by then. Madam Chair?
Thank you, Senator. And I think that's a good resolution, but I want to make sure that Senator Peake, Senator Suderline, and I don't see Senator Stewart in the room, but if you are amenable to that, we can make a motion to report all the bills to our full committee next week. And you will have that discussion before our meeting on Thursday.
Move
Madam
to
Chair,
report in block.
Oh, second.
All in favor? I'm sorry, we have to do a roll call. So Senator Howell?
Aye.
Senator Locke?
Aye.
Senator Peake?
Yes.
Senator Donovan?
Aye.
And I too am an aye. Thank you, senators, for reaching that agreement, and I think by next week we should have some better understanding of how these bills will work together. Thank you. I just want to say a quick word to our public who is joining us, just to share with you what I'm looking at. I've got a small computer in front of me where I see everyone in the Zoom room, but we have over 50 people in the room, so you well know now that Zoom cannot distinguish a lot of times who's in and who's out, who wishes to speak. So as we get to our next bill, one thing I will ask is that anyone who only wishes to speak in favor, raise their hand. I'll do my best to call on you. And once you have spoken, if you can lower your hand, that will help me. And then we'll move to anyone who is in opposition. I'm going to ask our staff to go ahead and put all attendees into the room as panelists, because I'm hearing that there are some people who wish to have spoken on our last bill and were not able to do so. So if you can move all attendees into the panelist category, that would help me see people who are raising their hand, and I could call on them effectively if that works for you. So let us go then to SB 1169 and Senator Normand. Senator Normand.
Thank you, Madam Chairperson. I have Senate Bill 1169, which in concept is a very simple bill. What it requires is, at least in our neck of the woods, before high school students are allowed to drive to school, they must obtain a permit from that school. Like some pieces of legislation, issues are brought to our attention out of the most tragic and egregious circumstances. What happened in this instance in October of 2019, that there was an event at one of the local high schools, and unfortunately there was a car crash that ended up killing 3 young 16-year-old boys as they were leaving the school where the vehicle had been parked. Unfortunately, none of them had driver's license or a driving certificate, but somehow they had obtained a school parking permit. So what this would require, it would not restrict the public schools from issuing the student parking permits. It would merely require that in order for the student to receive that they had to present evidence that they possessed a valid driver's license or some alternative driving privilege card.
Thank you, Senator. Is there anyone on our committee who wishes to speak to the bill? Seeing none, if we have any members of the public that would like to speak in support of the bill, this is SB 1169, please raise your hand. And I believe we have Shane Riddle who wishes to speak in support of the bill.
Madam Chair, thank you very much, and thank you for the opportunity to speak. The Virginia Education Association has taken a position to support SB 1169. Thank you.
Thank you, Mr. Riddle. Tammy Guido, you wish to speak in support of the bill? Tammy? We'll go on to Mike Asap. Mike, I'm sorry.
Can you hear me?
We can hear you, Tammy. Go ahead, please.
I'm sorry, little technical difficulty. Madam Chair and committee members, thank you for allowing me to speak to you today. My name is Tammy Guido, and I live in Yorktown, Virginia. I strongly support Bill SB 1169, and I'd like to share with you why. My son Connor had recently received his driver's license, and there was a junior homecoming dance with a friend to the dance. At the time, it was to leave the dance. Connor, along with his friend Logan and the unlicensed driver who was driving almost twice the legal speed limit, were killed October 26, 2019. This student driver was allowed to park on the school property for several weeks before the crash with a parking permit that was issued to him by the high school. No student should be issued a high school parking permit without having completed both the state required in and out of school training, as well as attaining the parent's consent. Had the school been required to have a valid driver's license presented before issuing a parking permit to the driver, I may not be where I am now today without my son, Connor. I can't save Connor now, but this law can help to save others. We want to ensure that the high schools are doing their due diligence across the state, protecting all students and drivers. Currently, the form is different from high school to high school, with inconsistencies in the form itself, as well as the process for obtaining a parking permit at high school. This bill will require all high schools in Virginia to have the same form and process going forward, which should be quite simple. This uniformed approach provides consistency and hopefully will protect young drivers to be compliant with all school curriculums and state laws. I urge you to support this bill in hopes that this bill will prevent such a tragedy from happening again to someone else, as no one should ever have to bury their child. Thank you, Senator Norment and the committee.
Thank you, Ms. Guido, for sharing what I know is a terribly difficult message on your part. Thank you very much for your testimony. Is there anyone that wishes to speak in opposition to the bill? If you will raise your hand. Seeing none, we can go ahead and, is there a motion to report?
Madam Chair?
Yes, Senator Locke.
Madam Chair, I would move to report. I remember this incident quite well, unfortunately, so I move to report.
Second.
Thank you. Senator Peake? Senator Peake is yes. Senator Donovan?
Yes.
Senator Locke?
Yes.
And I am a yes as well. Thank you, Senator Norment.
Thank you, Madam Chairman, and the committee. I appreciate it.
Our next bill is SB 1303. This is Senator Donovan. Senator, if you'll present your bill.
Thank you, Madam Chairman. First of all, as we start, there's an amendment on line 11. It would say virtual end. So it would basically, I'm on the wrong bill. Isn't that wonderful? Virtual and in-person education, Madam Chairman.
Is there a motion?
I'll move the amendment.
Second. All in favor? Aye. Senator, please go ahead with the presentation of the bill.
Thank you, Madam Chairman. I know as all of us sit here today, we have had very difficult conversations in our district about schools and how to best move forward to protect our students and our teachers. And I believe that the evidence substantially weights our decision in favor of making sure children that need it have in-person school opportunity. And I'd like to talk for a couple of minutes, Madam Chairman, about that. The World Health Organization shows us and has stated that school absence affects equity, education, child health, and development. We all know, I won't go into a lot of the details and talking points, but they say harms are greater for children of migrants, refugees, minorities, children living with disabilities, and children in institutions or in countries affected by conflict. We know that there in Virginia, we've seen this jeopardy verified. Number one, we have reports and evidence of significantly increased depression, suicidal ideation. In fact, we have reports from the Centers for Disease Control indicating that 1 in 4 young adults have seriously considered suicide in the past 30 days, with Black and Latino respondents twice as likely than any other group to report the same. We have evidence from our own child savers nonprofit group in Richmond that their wait list for services for trauma-informed therapy for low-income children is backed up by hundreds. Additionally, we have good evidence from RAIN, Rape, Abuse, Incest National Network, that 67% of children that have identified perpetrators identified them as family members, and 79% lived with them, causing their president, Scott Berkowitz, to say, stay at home does not mean safe at home. We have seen academic jeopardy for our children across the state. We are seeing our rates of failure of 2 or more courses doubling. We are seeing failure to meet literacy benchmarks like reading on an appropriate grade level, failure to meet that doubling. Virtual education is a wonderful asset and absolutely necessary during this pandemic, but more is needed, and there are many children who do not have a home situation that can help them succeed and achieve, and may even have safety issues. So when we look at the evidence of what the risk is for children, and this is evidence that was addressed by the American Academy of Pediatrics last year when they said we must have in-person available because the jeopardy for children outside of school vastly outweighs the jeopardy for their risk of COVID in school. So if we look at all of this evidence, and you all have read the articles and you know that it's more than I'm even talking about at this time, what is the risk of COVID that we're protecting from? Well, the science that we have makes it very clear from multiple different studies that children have decreased infection, decreased severity of infection, and little or no vertical transmission. That means transmitting it to another age group like their teachers. And that's why in Virginia we have seen virtually no outbreaks, despite the fact that child care, where children and adults are interacting all the time, has been ongoing throughout the entire pandemic. And schools have been open not only in some districts in public school systems, but also in the private school systems without transmission, without outbreaks, and without jeopardy to the teachers, the parents, the children. In fact, as of today in Virginia, in the less than 20-year-old demographic, they make up for all 11 months only 14% of all cases, only 1.8% of hospitalizations, and thank God, only 0.15% of the deaths. So this is a serious illness. We all know that it is. We know that it's highly transmissible. In fact, I would present to you staying at home is not significantly satisfactory in preventing transmission, because we all know many people who have been home and have contracted the virus. So for all of those reasons, it is clear to me, Madam Chairman, that not offering in-person schools is of serious jeopardy to our children. And as the state, as requested by the governor in March, closed the schools, I believe the school districts need some direction to help them get to the point where they will say they will open and they will find a safe way to do it. Those conversations have to happen, and they can happen in a collaborative way so that teachers are comfortable with the efforts that are made, but they must happen. So with that, Madam Chairman, I do have moms from, I know they've been trying to get on with your other bills, from all over the state. I hope you will let them each speak. They have been cautioned to not speak long, and it will probably be a little bit more than 3 minutes, but not much. But this is their one chance to have an opportunity to speak here, and I hope that we'll afford them that opportunity, Madam Chair.
Thank you, Senator. Why don't we hear from the public who wishes to speak in favor of the bill? This is SB 1303. If you will raise your hand, we will admit you to the room. And the first person I see is Kimberly Edwards. Ms. Edwards, if you would like to speak.
Hello. Thank you for the opportunity to speak, Madam Chair and Senators. Our children have not been inside school for 307 days. I need your support for SB 1303 to return our children to school. Our school board and superintendent keep delaying the return to school, favoring teachers' association demands over the needs of our children. Now, the teachers' associations are demanding all staff and students to be vaccinated before they return to school. I believe that the teachers should be able to be vaccinated, but there's no way that we're going to be able to get our children vaccinated. It's not approved. There is no vaccination approved for children. How long are we going to let Virginia's children fall behind? We are in a pandemic. It will last for years, but our kids cannot be forgotten. Young children and children with IEPs, such as my two boys, they're in special education, do not learn effectively in virtual learning. I see my son all the time putting his head down and not even paying attention to class.
Thank you, Ms.
CDC and the American Academy of Pediatrics both endorse in-person learning. Studies cited on the AAP website show no increased risk of community transmission when schools are open. Please help our children. Vote for their future. Force public schools to reopen 5 days a week in person for those who choose. I'm asking you today for my sons, Declan and Dagan, please support SB 1303. They are counting on you. Thank you.
Thank you, Ms. Edwards. And just as a reminder, I know we have a lot of concerned voices on this particular issue, but we do have many, many people who wish to speak. If you could keep your comments very brief, that would be most helpful for us to hear everybody. Ms. Sears, Joanne Sears.
Can you hear me?
We can hear you.
Thank you so much. My name is Joanne Sears, and I'm representing the thousands of parents in open FCPS in Fairfax County, Virginia. We need your help, Richmond. Our school board is completely incompetent and broken. Our children have not been in school in 307 days. I am a Girl Scout troop leader. Half of my girls go to private school, half of my girls go to public school, and the girls in public school are breaking. They have dark circles under their eyes, they're depressed, and they need your help. This is a huge emergency, and I would ask you all please to never take another dime from any teachers union until this problem is fixed. They're holding all of our children hostage. It's not a pandemic issue, ma'am. It is a staffing issue, and our children are being strangled by teachers unions.
Thank you,
beg
Ms. Sears.
I
Thank you.
implore you, please help us. Thank you.
Thank you. Ms. Walters, Mary Walters.
Hello, thank you very much. I am the single mother of an amazing 12-year-old exceptional needs daughter. She is in the 6th grade at one of the local middle schools in Chesterfield County. I work full-time and I do not have the resources to place my child in an academic learning pod or pay for her to go to private school. Not to mention that most of those options do not permit exceptional education students, especially with behavioral concerns. Public school is my only option. My daughter has had an IEP since she was 5 years old. She was in a contained classroom in elementary until she was successfully mainstreamed for 5th grade. We thought this was a major accomplishment. And then March 13th happened. She suffered academically and behaviorally. She could not adjust to her new life, and it showed in every aspect of her day. She became more and more dysregulated and became depressed and has even expressed suicidal thoughts at 12. In the fall, she started 6th grade via computer. Her education team has worked tirelessly, but most days my daughter simply sits in front of the computer, tuned out, unable to learn. Because she's no longer in elementary school or in a contained education setting, she was a last type of student to return to school at Chesterfield last fall. She was only there for 2 days before schools closed again. During those 2 days, she made friends. She was active and engaged. She loved every moment, and then it ended. Now, IEP students like her are being left behind again, especially in the middle and high school settings, as they are again the last students to return to school in our county. We need to get them back now. Thank you.
Thank you, Ms. Walters. And again, if we could keep the comments brief, we have at least 10 more folks who are waiting to speak. Colleen Clementson.
Good afternoon. My name is Colleen Clementson. Can you hear me?
We can hear you.
I'm a former Virginia Beach Public Schools teacher and a mother of 2 children in special education. In our back to school group, we have heard endless stories of students and teachers from all socioeconomic backgrounds, race, and nationalities having difficulties with school. Our particular school district's mission statement is broken into several parts, which all begin with our students, but the focus is no longer on our students. The opposing viewpoint suggests that those that are struggling that we get our children help, that this is only for a little bit of time, that we all have to sacrifice. The cost of services and availability of services put many at a disadvantage. For example, families of students who receive services like OT, PT, speech, and ABA therapy in the school setting are not able to receive those services privately because most insurances will not allow families to double dip. If services are written in an IEP, then it is the expectation of schools to provide this service, and for some it has been a nightmare. Many students are needing to seek help for mental health issues, but help is not available in person or virtually because providers no longer have openings. Stories of lower income students having to sit outside their homes on mornings when temps were in the 30s and 40s because their internet service was shut off due to lack of payment. They sat outside with their Chromebooks hoping to use the service from nearby community centers. Our districts are failing us. Supporters of 100% virtual learning say these are unprecedented times, and I say to them, we need to come up with unprecedented solutions for our students' issues and stop the whole children are resilient excuse or they are not behind. Because the fact is, yes, they are and will be behind. They are behind academically, socially, mentally, and emotionally as their peers who have been in school and in the public sector since the beginning of the year. Schools like in Texas,
Thank you, Ms.
Florida,
Clemenson.
Indiana, who have been open this whole
Thank
time.
you, Ms.
And now
Clemenson. Thank you. Let's hear from Jackie.
Good afternoon. I'm speaking today in support of 1303 that requires local school divisions to offer in-person learning. I am the daughter of a former teacher, and I'm a single mother of 2 elementary children in Henrico County. I would first like to say that our individual schools administration and my children's teacher this year have been doing amazing things given what we've all been facing. I know that they are working hard to try to engage our children. However, it is time for parents to have the option to send their child to school in person. Regardless of a parent's reason for wanting their children to return, parents know best for what their child needs. For all the children who are doing fine or great with virtual learning, this isn't about them. They have been given the option to always remain virtual. This is about equity. This is about the kid who virtual learning is not working for. This is about families that are currently drowning. This is about mental health. By keeping these kids out of school, you are creating a far more serious community health crisis. As Senator Chat Peterson said yesterday, the school system is about the best interest of the children, and at the end of the day, that is its purpose, and it's time for us to act. Thank you.
Thank you. Sandra Davis.
Yes, hello. Thank you for letting me speak. I'm from Fairfax County, and our school board remains paralyzed and at the behest of the local teachers union, which keeps moving the goalpost for opening, hybrid at least. Now that the teachers' vaccinations are coming about, they're starting to say that, well, we can't open because the kids aren't vaccinated, or we can't open until there's a 14-day zero community spread, things that are totally unrealistic. And we need to adapt better to our situation and not keep delaying. Not all of Fairfax County is wealthy or can afford at-home parent, homeschooling, tutors, private schools. Some parents here have actually moved half their family to states that are open. I think about 10,000 kids have disenrolled and counting. But not everybody's wealthy and can afford to do those things. There's worse things than a COVID infection for a child after a year at home and isolated. Reports of abuse have gone down, which is not a good thing. I think most of our parents here have remained silent because they think that the board is operating in good faith. But basically they have no spine and they're left to flounder under their union handlers. They could use some help in making the right decisions, and that's why I support this bill.
Thank you, Ms. Davis. We're going to hear from Lisa, and again, I'm going to ask you to speak very, very briefly. Just summarize why you're in support of this bill.
I'm in support of this bill because our school board is completely incompetent.
And if the decision to reopen schools is left with our school board, they will be closed forever. Every meeting, the goalpost moves. They cannot agree on a path forward with reasonable decision, strategic making capabilities. We are stranded here and we need your help. The school board refuses to answer our questions. Why are counties all over the country having 5 days of education and we have 4 days of virtual? I have an 8-year-old son who won't get out of bed in the morning to go to school, who used to run to the school bus last year. This is not public education. This has become an elitist economy in Fairfax County, and we need help. The school board is incapable of supporting us. Please help and pass 1303. Thank you.
Thank you. We'll hear from Yale 11.
Hi.
Hello, go ahead, please.
Can you hear me? Hi. Thank you for the opportunity to speak. I'm in Henrico County and I'm in support of Senate Bill 1303. I will cut my speech short because of the points that everyone has already made that are the same points. But I would like to say that this isn't about my kids because I can provide them what they need. This is about kids in abusive homes for whom school is the only safe place. This is about kids living with food insecurity. This is about kids who are thinking of committing suicide and those we've already lost to suicide. We're coming up on a full year of learning loss. And at the end, I would like to end with quoting the most recent guidance by a multidisciplinary group of experts at Harvard University, Brown University, Boston University, Tufts University, and New America. Although community spread metrics serve as important pieces of information, it is recommended that schools focus on rates of in-school transmission and metrics for the quality of infection control. All the data points to transmission not stemming from the schools. Thank you.
Thank you. I don't see any other hands raised.
I'm Janet Oakes. My hand was up.
We're asking you to raise your hand electronically on the raise hand feature, but please go ahead, Ms. Oakes. Please go ahead, Ms. Oakes. I'm sorry, you're on mute.
Unmute. All right, am I unmuted?
Yes, you are.
Okay. I live in Loudoun County. I have 2 daughters enrolled in 8th and 10th grade in the schools. I'm in support of Bill 1303. Our school board began phasing some students in disabilities in K through 5 in October through December, but then they chose to use the CDC indicators for the school decision making, but only using the 2 core indicators, which the CDC flat out says not to use as regulatory measures. As a result, despite our mitigation strategies having basically no transmission in 2 months, all of our students were pulled back to distance learning. At our school board meeting on Tuesday, instead of adopting the mitigation strategies consideration, they said that our schools would be out for at least 6 to 8 more weeks, if not longer, because 40 school nurses would be too busy giving vaccinations to teachers. There are no students in person. There is no plan to return them. There are, however, daycares and internet cafes inside the school buildings using county employees as supervisors. I would like the state to step in. Otherwise, I'm concerned that our students will not be in person either later this year or next year. Some families have pulled their students to go to private school. Some have moved out of state to educate their children. This shouldn't be happening. Most of us can't afford private schools. My husband and I are home and can help our kids. Thousands of students have no support. That's not equitable. It's not even close. Some of the classes just cannot be done. Our students need to be in person. I'm asking all of you to move forward with with Bill 1303. Loudoun County Public Schools is no longer prioritizing the importance of a proper education of our student. Without the state accepting it and helping, our students will fall through the cracks and the damage will be irreparable. Thank you so much.
Thank you. Next, I have Elise Davis. Again, please keep your comments very brief.
Hello, my name is Elise Davis. I'm a 9th grade student and athlete at Thomasdale High School. Recently, our community experienced the loss of a young lady who took her life. I didn't know her personally, so I can't imagine the pain her family and close friends are going through right now. Every social media platform is covered with pictures of her and messages about how her smile lit up the room and that her positive energy was contagious. No teen living through this pandemic can say it hasn't affected their mental health. She will never get married, have a kid, have a job. She will never get to experience the joys of life that her future could have brought for her. Everyone is so caught up in numbers and statistics that we are forgetting that everyone's mental health is suffering. It's happening in my household and all over. How much longer are we going to let COVID control our lives? While some households have a quiet space for working and a parent at home to help the younger kids, some don't. My mother is a single parent to 5 children and works. I find myself late to classes and missing instructions because I'm helping my 2nd grade special ed brother with his online school. My mother's at home as much as she can be, but she is the provider and must work. My education should not be at risk because of my family situation. On another note, school provides more than just an education. It provides social opportunities through clubs and elective classes. It also provides sports, which is good for students' physical and mental health. It provides them new opportunities for a career path by scholarships to send less fortunate students to college. Sports also provide a team and a support system to athletes. I may just be a high school student, but we are hurting and we deserve representation.
Thank you, Elise. And Todd?
Yes, thank you, Madam Chair. I really can't add a whole lot more to what these moms have had to say. These parents are great spokespersons for this bill. We support it here at the Family Foundation. And as a dad of 4 who has kids in school, I'm fortunate to be in a locality that does allow the choice for in-person. And I think that should be extended to other localities as well. So with that said, and in agreement with everything that has been said prior to me, the Family Foundation supports this bill.
Thank you. Nan?
Madam Chairman, do you see Amy Kenyon?
I'm calling upon Nan Itel right now, and Amy, I see Amy, yes. But Nan, please go ahead.
Thank you, Madam Chairwoman. My name is Nan Itel. I'm the parent of a Fairfax County High School junior. And to reiterate many of the points, I'll be just very brief. In 307 days, our child has not seen the inside of a school or the face of a teacher on anything other than a screen. And that same time period, our Operation Warp Speed at the federal government has developed, tested, manufactured, and distributed a vaccine. In 1787, our founders wrote a constitution in 126 days, and Fairfax County Public Schools cannot get opened up. We desperately need your help, Richmond. Multiple scientific and medical sources and private and public school experience show school can reopen safely. And there is broad bipartisan agreement that kids should be in school buildings, including a commitment by the incoming Biden administration that reopening schools should be a first 100-day priority. But the federal government has no authority beyond its bully pulpit. And fortunately, you do under Article 8 of the Virginia Constitution. Remote learning is a failure. Fairfax County Public Schools are a failure, and they have failed every child. You are the last, best, great hope to save a generation of Fairfax County and Virginia students from the abject failure of the political leadership at the local level across the state of Virginia.
Thank you, Nan.
Reopen schools.
Kathleen Friesen.
Hello, Madam Chairwoman. My name is Kathleen Friesen. I'm a parent of a 3rd and 1st grader in Fairfax County Public Schools, as well as a software engineer. And in addition to all the many good points that have already been presented, I just want to say that the web tools that our schools are relying on are just utterly insufficient. Every single day when I'm able to be home, I'm an essential employee, but I'm typically out of the house. Something's crashing. Somebody's mic's not working. The education that superintendents think might be delivered is being left to tools that do not work, and we need to be in person because people work. Thank you very much.
Thank you. Sarah Allen.
Yes, thank you for letting me speak. I am a hospice care provider. I'm a CNA. My husband is also an essential worker. We have to work outside the home. I was fortunate to get a scholarship for my youngest child because she's only 8. We could not leave her alone. We will not be able to continue to pay for the remainder of that private school tuition next year. My 10-year-old and 12-year-old, we've had no choice to leave them alone doing virtual. My 10-year-old, my fifth grader, wraps himself in a blanket and has gone from being a straight A, healthy, happy, athletic, just a really popular kid to wrapping himself in a blanket, laying on the floor saying he hates school and he hates life. My 7th grader has a 504 plan that has not been followed at all this year, and she is failing 2 classes. Our kids need to go back to school. Essential workers need help. We are tired. We were out in the community helping, and we need the schools to help us. Thank you.
Thank you. And Amy Kenyon.
Thank you, Madam Chair. I'm Amy Kenyon, and I'm coming to you today from Henrico County. We have been held hostage here as well, like a lot of other people said, by our school board. I'm actually also coming to you. I am the mom to an 11-year-old son, and I currently don't even have a dog in the fight, because when I saw how terrible virtual learning was last year, I made the decision in July to move him to private school. He's been attending private school since August in person, 5 days a week. 18 children in the class, and has been able to do so successfully. I would love for him to be able to go back to private school someday. So I just hope that y'all can please do the right thing, because the school boards cannot, and everybody come together and get these kids back into school, and just help us parents do that. Thank you.
Thank you. I don't see any other hands raised to speak in support of the bill. I'm going to ask staff, or rather I'm going to ask any individuals or organizations that wish to speak in opposition to please raise your hand, and we will bring you into the room. Is there anyone that wishes to speak in opposition to the bill?
Madam Chairman, while we're waiting, may I please thank you for letting everybody speak? I really appreciate it.
Absolutely. Thank you. Staff, I'll just ask, is there anyone waiting to speak in opposition to the bill? Okay, I see JT Kessler. JT, please go ahead.
All right, thank you, Madam Chair and members of the committee. I'll be brief. I represent the Virginia School Boards Association. School board members are faced with very, very difficult choices in this pandemic. They have to weigh multiple data points in making the decisions whether to return to learn. Some divisions have decided to do that in a hybrid model. Some have decided to do that in person. Some have stayed virtual. They have community decisions that they have to weigh in making these decisions. I can guarantee you this: every school board member wants to have their children back in the classroom full time. There's a vaccine coming. When that vaccine gets enough to where we can feel safe for our staff and our communities, they will be back in class. We need to keep this decision at the local level, and I urge the committee to not pass this bill. Thank you, Madam Chair.
Thank you, Mr. Kessler. Is there anyone, Shane, are you waiting to speak in opposition to the bill?
Yes, Madam Chairman. Madam Chairperson, yes, thank you very much. I'm Shane Riddle. I represent the Virginia Education Association. And listen, we've heard the parents. No one wants Virginia students to be taught inside the schools more than Virginia educators. Those who work with children daily, such as teachers, bus drivers, and child care workers, guess what? They're now being prioritized to be vaccinated. And that's very good. And we're up in phase 1B, which is very good. And so we know that virtual learning is not a true substitute for in-person instruction that we've embraced for generations. But as our nation surges past 360,000 deaths from this pandemic, it's the safest and wisest course to take right now. It's in everyone's interest to get back to teaching and learning within our school buildings, but that must be done with health and safety as our #1 priority. According to the Centers for Disease Control, while fewer children have contracted COVID compared to adults, they can still be affected by the virus. They can still get sick, and very importantly, they can still spread the COVID-19 virus to others, even if they're not showing symptoms. So we will get through this, but right now, safety is our priority, and that must come first. And I appreciate the time that you've allowed me to speak.
Thank you, Shane. And Tiffany.
Thank you, Madam Chair. My name is Tiffany Fink-Haynes, and I'm here on behalf of American Federation of Teachers in Virginia and our thousands of members who work and teach in our public schools every day. Like Shane said, our educators want nothing more than to be back in the classroom with their students, but our #1 priority is the health and safety of staff and students. Right now,
Unfortunately, cases are surging in Virginia. According to the CDC and VDH health metrics database, every district is in the highest risk category. And so we were really happy that 1B vaccination started this week, which includes teachers and support staff. And we're hoping the conditions change soon and we can all get back into the classroom for in-person learning. But we think it's critical that school districts are able to make the decision on their own about when that time is right. So we're in strong opposition to this bill. We encourage every member of the committee to oppose it today. To make sure that our school districts continue to stay safe. Thank you so much.
Thank you. And Tom Smith.
Yeah, Madam Chair, Tom Smith with the Superintendent's Association. I just want to piggyback on what you've heard from the teachers and the school board. I talk with superintendents every week. This has been an extremely difficult decision for them. They agonize about it because they know that students need to be in schools. But they also know that their job is to keep school and students and staff safe. And so they've had to balance those needs. They've followed the guidelines from the Department of Education and the Department of Health in making those decisions. You've seen different decisions across different parts of the state for the reason that the virus is hitting different parts of the state differently. And so localities, superintendents need to make those decisions based on the needs of their locality at that point in time. We go along with saying that, when we get folks vaccinated, when things do change, then we'll be able to bring more of our students back in. But right now, it's student safety that is on the minds of our superintendents. Thank you.
Thank you. John Benton. And Emily Belisle, do you wish to speak in opposition to this bill?
I wish to speak in support of it.
We have closed public comment for speaking in support, but I imagine that your comments probably reiterate the messages that we heard from other parents earlier. Is that correct, or do you have any additional comments?
They reiterate.
Thank you. And John Benton, does John wish to speak in opposition to the bill? Okay, I don't hear any further comments either for or against. Do any of the committee members wish to make any comments? Is there a motion on the floor?
Madam Chair.
Yes, Senator Locke.
Madam Chair, I think that our school divisions have been working very diligently in this virtual learning environment, and certainly no one wanted to go into that kind of environment. And it certainly is best for students to be in classrooms, and we should be proud of the work that our students and staff have been doing in virtual learning. We certainly want our students back in classrooms, but first and foremost, what we want is the health and safety of our students and our teachers and our staff, and that should be first and foremost. And we certainly should be encouraged by the impending availability of the vaccine for all teachers and staff and administrators. And we should be looking to whatever other mitigation strategies are coming forward. But this is a decision that should be left to local decision makers as they consider whatever respective data, mitigation, vaccination rates should guide their decisions. So for that reason, I will not be supporting this bill.
Thank you, Senator Locke. Senator Donovan?
Thank you, Madam Chairman. If nobody else wants to comment, did you want to comment? That would be great. Give me just a minute. I'd love to respond and just close this out. I love hearing that we need to make this decision based on safety and welfare, as spoken by VEA when they spoke earlier, because it is unequivocal that the safety and welfare of our children is put in jeopardy by not having any in-person education. It is absolutely unequivocal. You just heard a report from the major universities of the country, Harvard and many others, that it is not appropriate to be basing decisions on community spread, but to be looking at schools individually because the transmission rate, the risk of COVID, is not a safety risk to children in comparison to the risk of what they're dealing with outside of school. Yes, there is a risk of COVID. It is profoundly decreased for children and for the people around them. The risk of what our children are living with every day is staggering, and you saw the mothers who are speaking in advocacy for their children today, many of them with IEPs, many of them with other challenges in their lives that need the support and safety net of school. I strongly encourage you to support this bill. We move forward. And I believe the governor just made an announcement that he's in support of moving towards a position where schools should be open as well. So I think we're actually all on the same page, and I hope you'll move this bill forward.
Thank you, Senator. Senator Peake, did you wish to speak?
No, I would just move to report.
Second.
And Senator Peake, how do you vote?
Yes.
Senator Donovan?
Yes.
Senator Locke?
No.
And I am a no. So we have 2 and 2.
Yes, ma'am.
Thank you. With that, we will go to SB 1322, and at first I do want to offer my sincere apology to Senator DeStep. He's been waiting very patiently, and I apologize. I should have called on you prior to our committee members, but Senator DeStep, if you would present your bill, I would appreciate it. Thank you.
Thank you, Madam Chair. Sorry, Senate Bill 1322 is about seizure management and action plan training within our schools. And what this does, it's very simple. It allows the parent or guardian of a student diagnosed with seizure disorders that they may submit to the local school division a seizure management plan that was developed by the student's treating physician for review by the school division employees with whom the student has regular contact. The action plan may receive at the school while participating in school activities, and this just talks, the bill basically says that we're going to train our school nurses and the employees who have significant contact with the student. The training for this is provided by the Epilepsy Foundation of America and paid for by the Epilepsy Foundation of America. So with that, I know we have some speakers, so I'd like to get to them. I know some of them have been waiting a long time.
Thank you, Senator. For any individual who wishes to speak in support of the bill, if you will raise your hand. I see Barbara Westland. Barbara, please go ahead.
Thank you, Madam Chairman. Good afternoon, Madam Chairman and committee members. I'm Barbara Westland. I live in Williamsburg, Virginia. I'm here to speak in favor of SB 1322. I'm a teacher at Yorktown Elementary in Yorktown, Virginia. This bill is very important to me. As a teacher, one of my highest priorities, easily competing with student learning, is keeping my students safe. Jamie Van Cleve was one of my first grade students 10 years ago. Jamie and I were walking down the hall one day, chatting quietly, when Jamie went silent. It was clear that though she was physically still there, she was not conscious of my presence. I took her to the nurse, who declared she was fine and sent her back to class. I was so troubled by what I had seen that I contacted Mrs. Van Cleve. I didn't want to worry her unnecessarily, but my heart knew that something was wrong. When I later learned that Jamie had suffered a seizure, I was heartbroken, not just because I love her as a student, but because she has to face this illness. And I did not have the knowledge to even know what was happening with her. I could have missed that seizure. The nurse did miss the seizure. I don't know what epilepsy looks like. I didn't know the difference between a daydreaming student and a silent seizure. The cost of a school nurse or teacher being ignorant about seizures and seizure management is too high. Teachers need to understand how to identify a seizure. School nurses need to have a seizure management plan on file if the parents so choose, and need to be trained to properly carry out those plans. I don't understand how there can be a question or a need to debate this. How can anyone disagree with taking care of our students? This bill empowers schools personnel to protect our student population who suffer from seizure disorders. I ask you to please pass this important bill. Please help those of us working in public schools to protect our students with seizure disorders. Thank you so much for your time.
Thank you. Karen Foster?
Hi, I'm Karen Foster. My daughter, Christina Foster, was a Virginia Beach Public School student and is now a Virginia Beach Public School special ed teacher. And she wishes she could be here today, but she is virtually teaching her children. When Christina was in elementary school, we kept hearing reports from her teachers that she was spacey. It was a few years later, when she was in middle school, that I stumbled upon a description of absence seizures, and Christina was diagnosed with seizures. We wish that the teachers had been trained to recognize a seizure. We didn't expect them to give us a medical diagnosis, but it would have been helpful if they had encouraged us to speak to Christina's physician rather than just telling us she was a spacey kid. When she was in 15 in high school, she had her first grand mal seizure in her class. Her teacher did not know how to react or respond. We didn't have a seizure plan in place because we didn't know she would have a grand mal seizure. As she lay seized on the floor, her head banging on the floor, the teacher ran out of the classroom. The students were afraid. They didn't know how to respond either. The next day, Christina began training her teachers on her own how to respond to a seizure, and her classmates. The next time she had a seizure in school, the students responded and provided seizure first aid for her. She said that we had no IEP or no 504 plan for her. She was a good student and she was succeeding in school despite the difficulties. As a special ed teacher, she says that she knows the limitations of those plans and that a 504 plan and an IEP cannot replace the preparedness provided by training the school staff to respond to a seizure. Please vote yes for SB 1322, the Jamie and Bree Strong Act, and make our schools safe for the people whose seizures don't look like the seizures you see on TV, or people who don't have a history of seizures but will have one at school, for the school personnel who don't know how to respond, and for the students and staff like our daughter who have epilepsy, to ensure all school personnel are not only prepared but can recognize and respond to seizures. The teacher across the hall from Christina last year had a seizure in the classroom, and her assistant did not know how to respond to the seizure, did not know how to give first aid. Christina has since been training her school staff and others in the school how to handle seizures, but that shouldn't fall just to Christina. It should be happening in all the schools across the state of Virginia. Please support SB 1322. Thank you.
Thank you, Ms. Foster. And Jamie.
Thank you, Madam Chairman and Public Education Subcommittee members, for allowing me to speak.
Jamie, if you could speak just a little louder, that would be helpful. Thank you.
Thank you for allowing me to speak. My name is Jamie Van Cleve. I'm 17 years old and I have epilepsy. Since late 2018, I have been working with the Epilepsy Foundation of America to increase epilepsy awareness, create seizure-safe schools, and remove the stigma associated with epilepsy. I've been trying to get my seizures under control for 10 years. There have been many ups and downs, but we are not there yet. My first seizure was at school and no one contacted my parents for hours until my first grade teacher contacted my parents at the end of the day. The school nurse did not recognize it as a seizure, and it was against school policy for my teacher to contact my parents. I have to work around my challenges of living with epilepsy, and epilepsy affects me in some way every single day of my life. These struggles would be a lot less challenging if people knew how to assist me in the event of a seizure. Living with epilepsy can be very difficult. School is especially difficult because it can be terrifying to go to school not knowing if a seizure will happen or if someone will know what to do. Every day I have a strict schedule around medication, sleep, diet, seizures, and side effects of medication. Sometimes I have to miss school or opportunities to do things with friends while my body recovers from the seizures and medications, and I have to work extra hard to focus in school and making up work that is missed from days absent. There is no cure for epilepsy, but for some it can be controlled with diet and medications. However, that is not my case. Along with 30% of all people living with epilepsy, I am still fighting for seizure control. I was selected by the Epilepsy Foundation of America to serve as an ambassador for the InEpilepsy.org campaign. This will be my third year serving for Teens Speak Up and Public Policy Institute program, the National Foundation Centerpiece Advocacy Initiative. I've met with several legislators, including Senator Kane, to discuss legislation important for the health and safety of people living with epilepsy. For my year of service with the foundation, I have focused on seizure-safe schools and starting a conversation about epilepsy so that we are seen as the normal people we are. Epilepsy is not rare. As long as there's no cure, we need safety. Keeping someone safe during a seizure is easy. Please learn the steps. 1 in 10 will experience a seizure, and 1 in 26 will develop epilepsy in their lifetime. There are dozens of types of seizures, not all involve jerking or convulsing. This bill is not just about epilepsy. Like I mentioned, 1 in 10 people will have a seizure. Seizures can be caused by countless things, and causes are not always known. Help us keep all people safe in the public schools of Virginia. Thank you.
Thank you. Kathy?
My mother would like to speak after me, too.
Oh, please go ahead.
Yes, thank you very much. I'm sorry, I'm going to refer to my notes just a moment. Madam Chairwoman, thank you so much to the members of the Senate Health and Education Subcommittee. My name is Chrissy Van Cleve, and Jamie of the Jamie and Bree Strong Act is my oldest daughter. I'm a working mom. I'm an advocate. Following in my daughter's footsteps this time, I was recently selected into EFA's Epilepsy Foundation of America's Advocacy Champion Program in Virginia as a nonpartisan representative to serve as a liaison between legislators, national headquarters, and the local Epilepsy Foundation office. In the Senate, 38 of 40 senators voted yes in 2020. Thank you for those who voted in favor of SB 420 and showed at least 11,000 children in Virginia that they are not a burden. Please vote in favor of SB 1322, the Jamie and B. Strong Act. This is not just about epilepsy. The free, online, already developed by CDC and EFA 1-hour training that comes with continuing education credit will keep children safe at school who have suffered concussions, severe dehydration, who have diabetes, autism, some heart conditions, and many other acute and chronic conditions that can cause a completely unexpected seizure for which there is no seizure action plan at all. Jamie and Bree came forward to advocate for seizure-safe schools because their experience is constant and it's enduring. Since we testified last year, Jamie has undergone approximately 20 medication adjustments. At the worst this year, she had as many as 8 seizures a night, and this continued for months. Jamie was admitted to the hospital for seizures 5 times in 2020 for multiple days each time. She arrived by way of ambulance on 3 occasions. You escaped the hardship that came with COVID-19. For us, we were already trained for the isolation, for the tether to our homes, and for the precariousness of health. In 2020, Governor Northam, at the request of Jamie and Bree, proclaimed March 26 Epilepsy Heroes Day. In that proclamation, it states, as quoted from CDC, and I quote, "The public is often unable to recognize common seizure types or how to respond with appropriate first aid. And whereas through action together, the Commonwealth of Virginia can increase public knowledge about epilepsy and seizure first aid and change the way people think about epilepsy and seizures." In a previous school, Jamie would be sent to walk alone or with another child to the nurse's office when she was having auras. Auras are actually seizures, and often a signal of something worse to come. Just as recently as this week, Jamie was in a meeting with a superintendent of schools who happens to be a supporter, and she had a very subtle seizure. The superintendent admitted he did not recognize it was a seizure. I explained that this small, seemingly insignificant seizure is potentially foreboding of a very challenging night. If we are not made aware that these happen, we literally could lose our daughter overnight. And it has happened to several people we know. That night, she ended up in the ER after hundreds of small clustered seizures because I knew to watch. I was there, I knew about it, and we were able to keep her safe. School Superintendent Dr. Victor Shandor of York County had the call
Jamie.
Virginia
Jamie, we have a few more speakers behind you. If you could just wrap it up, that would be helpful. And thank you. I think we understand the challenges that Jamie has faced. Thank you.
Yes, I'll just wrap it up and say, you know, seizures can be scary for people who don't know what to do. It can look like a person is dying. I know people who've become aware after the seizure's over and find themselves lying on the ground without anyone coming to their aid. Please help get rid of the fear and ignorance around seizures because minutes and seconds count. Please vote in favor of SB 1322. Thank you for giving me time to speak.
Thank you. Thank you. Kathy O'Hara, are you speaking in support or in opposition to the bill? Kathy, can you hear me?
Yes, I am in support.
And please go ahead.
Yes. Hello, I'm Kathy O'Hara. Thank you, Madam Chairman, for inviting us to be able to speak. I have been the epilepsy nurse clinician in child neurology at Virginia Commonwealth University for the last 35 years. I have worked tirelessly on educating families, the community, the schools, the school nurses in the state of Virginia and actually around the country. I have written multiple articles on seizures and seizure first aid. It is so important. As a nurse, I am here to tell you that school nurses get almost no training in their education on seizures. And the scariest thing is not to know what to do and to be able to pick up on it. It is so important that everybody get this education. It is very easy to obtain this education. It can be done online. It has been done so well that there is no reason that everybody is not doing this within the school systems. We understand that there are not school nurses in every school, and that when there is a school nurse, she's got more than one school, and that she has to delegate. So we need everybody. And when I say everybody, I mean everybody, including the students. The students are your best advocates for these kids, and to be able to take care of what needs to be done and to help. And so they should be educated as well. So I am in complete support of this bill. It is something that is so simple to do and doesn't cost anything to be able to do this education and to keep our children safe and in school. They need to be in school. Thank you.
Thank you. Are there any speakers in opposition to the bill? Please raise your hand if you wish to speak in opposition to the bill. And JT Kessler, please go ahead, JT.
Thank you, Senator Hashmi. I represent the Virginia School Boards Association, and we oppose this bill because we believe that the federal 504 plan addresses this issue at the school level. As a former educator for 10 years, I participated in a number of 504 plans where you bring the teachers, the school staff, the parents, and anybody that maybe if there's a medical condition, you bring them in and you have a plan and put a plan in place that can work to mitigate any of the conditions that a student may be experiencing. We believe this is working, and when it's done in a collaborative manner, it works very well. I empathize with what we've heard from the previous speakers, but to create a class or for a certain person or a certain group of people with a medical condition, we think that can be problematic because what's going to happen, we're going to add another layer to someone who may have another condition. When you have a 504 plan, or a 504 legislation and plan, that was there to address these individual situations, and to add classifications on top of that outside of the 504 plan, we feel is excessive, and would urge that this bill not go forward. Thank you, Madam Chair.
Thank you. Tom Smith?
Yes, ma'am. Madam Chair, can you hear me?
Yes. Well, we lost Tom. Can we bring Tom back? Tom, looks like you're back in the room. Please go ahead.
Madam Chair, can you hear me?
We can hear you, yes.
Okay. Yes, ma'am. We also have some concerns about the bill. First off, many of the plan requirements that are listed in the bill are already in place. I've about a practice with students who have health issues, so we're not sure that that is necessary. We're also concerned about the training requirements. We're not just talking about teachers of the children who have these children, but we're saying all employees whose duties include regular contact with students. That's not just teachers, that's not just aides. That's cafeteria workers, that's custodians, that's bus drivers. In some small systems, that's even maintenance personnel. So we're concerned about the vast amount of persons that need to be training. We understand the issues that the parents are and that the advocates are putting forth, but we feel that the training is a little bit broader than what we would like to see. And also we feel that the plan requirements are already in place. Thank you.
Thank you. I see no more speakers in the room. Any comments from our committee members? Any questions for the patron? And Senator DeStep, did you want to say a few more words?
Madam Chair, if I may, first, I forgot to mention up front that we do have a substitute to this, and I believe the substitute has been distributed.
Do we have the substitute in LIS?
It'll be there momentarily.
Thank you.
I apologize, Madam Chair. I had this in front of me. I had the note, and I just did not pay attention to my note. Then,
will you speak to the substitute, please?
Yes, Madam Chair, I actually will. And I'd also like to speak to what one of the associations brought up, and I'm happy and glad they brought it up about the 504 and the IEP, because one of the most misunderstood beliefs falsely spread that seizure action plans are not required because they're available under the 504 and IEP programs. But Madam Chair, they are not. If a child does not need accommodations or modifications, then they would not have either of those plans. So they would not have a 504 or an IEP. So I wanted to clarify that up front. And Madam Chair, secondly, it was brought up about, well, everybody who has contact with the student must go through this, from the crossing guard to whomever. And Madam Chair, in the bill and the substitute, on the substitute line 283, talks about that each local school division shall require all employees whose duties include regular contact with the student to complete on a biannual basis a Board of Education approved online course. And again, that's the Epilepsy Foundation paid for and approved course that falls in line with this. And this plan the seizure management plan would be put together by the treating physician for that and reviewed by the school division employees with whom the student has regular contact. So, Madam Chair, I believe that this is the appropriate thing that needs to happen when we talk about epileptic seizures and seizures as a whole. And as quoted by the governor when he set aside Epileptic Seizure Day, it's time we educate the individuals involved and we take a forward leaning step with this. And with that, I hope the committee finds it favorable to move forward on this bill.
Is there a motion for the substitute?
Move the substitute.
Is there a second? Thank you, Senator Peak. All in favor of the substitute, please say aye. Is there a motion to report?
Move to report.
Is there a second? Thank you, Senator Peak. Let's take a vote. Senator Locke?
No.
Senator Donovan?
Yes.
Senator Peak? Senator Peak is a yes, and I am a yes. The bill will report to full committee. And I apologize, I should have said on the previous bill that we had discussed, that was SB 1303, that bill reports to full committee next week. And Senator, thank you, Senator DeStep. We have one more bill that is SB 1317. I believe, Senator Donovan, do you have, you want to pass it by for the day? Is that correct?
Please, Madam Chairman.
We will pass SB 1317 by for the day and take it up next week then. And I'll just ask staff, does that conclude our full docket for today?
You have SB 1099.
Madam Chair, I believe that bill was included in the block of CSA bills that you
Yes.
all reported, or was intended to be included.
Yes, SB 1099 will be included in that block for next week. With that, I believe we have concluded our docket. I thank members of the public who joined us and offered testimony, and I thank the members of the subcommittee and the patrons who brought the bills today. Thank you.